So, got it. The title of the presentation today is the Artificial Intelligence Patient Librarian for HR plus HER2 minus metastatic breast cancer patients. So my name is Yvonne, and as Dr. Pezo said, I'm a research scientist at UHN and adjunct faculty member at the Department of Psychiatry, University of Toronto. And I'd also right now teaching full-time at a university called Northeastern University in Toronto campus. So this project is actually funded by FISA. And then it's a 2 years project, and here's the list of collaborators on the grant. And then Dr. Michelle and Dr. Danielle are my medical consultant, and I belongs to a group called named the Sousa Institute at UHN. We focus on professional education, including cancer patient, cancer caregiver support. So the idea of the chatbot, it's it came from the grant itself, that there's a call from FISA, global medical grants, saying that there's lack of dedicated resources or educational resources for metastatic breast cancer, with specifically this subtype HR plus or HER2 minus. So according to the literature, and as you may all know, it's a very common subtype of breast cancer, metastatic breast cancer. And then they have, on average, excuse me, longer survival compared to other subtype. And then the disease management is a little bit complex. Sorry, wrong throw. So yeah, so I was thinking there's a lack of education support, information support. Let's do something technology driven to allow us to scale the educational effort for the patients and their caregiver. So I was thinking, because I have some background in natural language processing, deep learning, machine learning training. So I may be able to put together the existing resource, and then our expertise at the Sousa Institute. We focus on education, educating professional and cancer patients. So put all this knowledge together to create a chatbot that can scale a quality patient education. So the chatbot can do two things. One is to explain in a very simple terms that patients, their symptoms, the side effects of treatments, and what are the treatment options available for their specific type of cancer. And also suggest online resource mainly to enhance their ability to self-care. And then it based on tailor to their needs and questions. Because so when I started the project, I looked at Princess Margaret, and then there are actually over 1,000 online and in-person paper-based education resources at the patient library for a cancer patient and their family member in general. So this webpage is just gives you a taste of what they're offering, and then as you can see, there's quite a bit of information. You can browse, search, and then there's a different tabs, and each tabs there's many different topics, like from caregiving, financial help, safety, palliative care, coping, blah blah blah. So, but there's no specific resource. It's true. The call is right. There's no specific resource dedicated for this subtype of breast cancer patient. So then the goal of my grant was to address the supportive care needs for this subtypes of MBC patients, leverage existing resources to advance the field of patient education and treatment decision support, and also scale up the high quality supportive care by adopting artificial intelligence technology. The highlights here is the existing resource. Because I'm a researcher, I'm not a medical doctor or nurse, and I cannot provide a diagnosis or any medical information to patients. So the only thing that I can do is to recommend the existing resource that from the patient librarian, from the patient library, and then try to match their question to the specific resource that's suitable, may be helpful to answering their question. So the objective of the study is to develop a chatbot that can deliver a conversational-based education material, and also direct patient to explore specific resource online. And these resources are actually coming from the patient library at Princess Margaret. And then at the same time, we match the resource to their questions, to their needs. Right now, we already completed the phase of developing the chatbot, testing it. And right now we're entering the beta testing with the actual patients. So we need 50 MBC patients with this subtype of MBC. So when we started out the project, so we just gone through, without too much medical knowledge myself, we just gone through the literature, and then I work with a few patient education specialists and the patient librarian, and also a few graduate students, nurses, and then to focus on like what are the concerns and educational needs, informational needs of this type of cancer patients. A lot of them are quite universal. So all these metastatic breast cancer patients will share the common concerns. But specifically for treatment and side effects and medications, those are really specific to this subtype of cancer patient. So this is how Dr. Michelle and Dr. Danielle came in, because they have the expertise in this type of cancer, and also they know how to treat them and what are the side effects and upcoming trends and including clinical trials and new drugs, all that. So when we developed the education piece, their hard-coded education conversations with the patient, I can show you in a minute. That piece we are not sure, and we just based on the literature, and hopefully, and it was very fortunate that we have two doctors coming on board, and then to go over all this material with us, so then we ensure the accuracy is there. So the other parts of the chatbots are also conversational, and then they focus on the generic needs of the metastatic breast cancer patient, like the supportive care needs, their emotional support, all these other like common things about palliative care, options and death and dying and all that. So where the AI came from, like what kind of role that the AI plays in here. So in fact, we designed the chatbot as a hard-coded chatbot because we don't want the AI to be creative. And as you all may know, right now, ChatGPT or large language models come in into the market, and then they can be very powerful, but at the same time, they can be creative and delusional, or hallucination, that is the term. So they can make up information that's not 100% accurate. So then we decided back then, we started this project 2019, and then we decided to have it hard-coded instead of let the language model to generate a response for patients. So then a lot of the teaching to walk through patients about their treatment, their disease, their options, It's all hard coded. And then the only part that we let AI to do some work for us is the classifications recommender system that we built. So we base on the concerns of the patients, all these keywords, and the resource, which is online resource, which is used by UHN, and then we combine the two to make it like a matrix. So it just basically input output, right? These concerns will output this website kind of thing. So we also enhance the matrix by crawling the web. It's called web crawler. It's just a bunch of codes that a script that go online and go through each website that UHN used to grab the content from their website and put it as our concern as well. So our input will include the actual content of the website, and the output would be the website. So when we do the deep learning training, and then when patient enter the keywords that's related to those concerns, then the machine learning will be able to match the patient concern to the actual website that containing information regarding their concern. So this is how it's done. Let me maybe give you a. Can you guys see my screen? The chatbot.
Yes.
Yes. So we name it Robbie. And then these are all hard-coded information. And then we invite the patient to pick one of the options here. So for example, one of the major part that Michelle and Danielle built with us is the treatment options, treatment consideration, side effects. So if you click on it, and then it explained what kind of treatments that you will get for the first line, second line, and then if you're a younger patient or perimenopausal patients. So we have separate the information into different diagram, and these diagrams are generated by our students and the research team, and based on the information that Michelle and Danielle provided, and then we will keep asking the patient to pick one of these questions here. So if they pick endocrine therapy, it's explain what endocrine therapy does. So you can know more. You can click yes, and then keep talking. Does it make sense? If you say yes. If you say no, it's just repeating itself. It's like, and then in the wording that's slightly different, worded slightly differently. And then you can say, okay, explain more to me. Okay. So this kind of like interactive learning, we make sure that the patient is reading and say like I'm good, okay, or can you repeat? So if they want to know more about side effects, we bring them to side effects. So at the end of the conversation, we invite the patient to type a question for us. So let's see if I can think of a question. Can I know more about medications used in endocrine therapy? Hopefully it does understand me. Oh, it does. So the robot will check by sentence and then process it a little bit using NLP, and then put it into the classifier, and then matching all this information here to our matrix, and then pop up a hormonal therapy for breast cancer. So it kind of makes sense because I asked for endocrine therapy medication. So it brought me to Canadian Cancer Society and this page about hormonal therapy for breast cancer patients. So not that bad. I was like, phew, really
I was going to say, we've done a bunch of tests of these, and it does a really good job. You know, sometimes it does bring the
Here.
patient to like a blog post about it that's not quite the best. So I mean, I think this is all what we're gonna see in Yvonne's like pilot testing is whether patients actually find it useful. And I think Yvonne, at some point, it probably is interesting to know from the clinician perspective, like, is this actually helpful?
Yeah.
You know, for the patients, or are they just coming with all these questions because it's brought them somewhere that they shouldn't have been brought?
Yeah.
So I think, you know, there's still potential difficulties, but sorry, I know I interrupted. I think, and there's still, it was difficult, you know, when Danielle's not here, but a little bit difficult to try to give information which was specific enough that it was helpful to the patient, but also broad enough that it would apply to most patients, you know, and that we weren't putting some information that might only apply to the very narrow. So, you know, it is broad. There's obviously still gaps, but you know, the nice thing about the AI portion of this is that can always be built on and improved.
Yeah, so we do.
I have to go to clinic in 10 minutes.
Okay.
I don't know if there's anything you want me for. I have 10 more minutes.
Sure.
Sorry.
I can stop talking. The rest of the presentation is about we need to recruit 50 patients by December, and right now we have actually 21 patients from UHN, and then we are hoping to get a little bit more from Sunnybrook, and I can share the materials as you can see right now here. We have a poster, we have a moving poster, and hopefully if you guys are interested, I can share with you this post. And yeah, so that's it from me for now. And Michelle, would you like to add anything?
Sure. So yeah, eligible patients.
And then also if anyone has any questions for Michelle, maybe before you go, would be great.
Sure. Eligible population is anybody with like locally advanced unresectable or metastatic ER/PR positive HER2 negative breast cancer at any point in their disease trajectory. What we've been finding easiest is we have a bunch of the printed pages that we offer to patients. And then basically they get a questionnaire before, then they get to play with the chatbot and a questionnaire after. They can do it in the comfort of their own home. Usually they can use the QR code to contact the study team, but I often just ask them, I say, are you okay if I pass along your name to the study team? And I think that's helped because then the study team actually contacts them. And then you guys just need their name and like a phone number because they don't have access to the patient chart. We found it kind of interesting because like sometimes a lot of the older population is really interested, you know, they may not be interested in like drug trials or other things, but I've had a couple like older women that are like, I used to be a librarian. This is so interesting. Like, I'd love to provide feedback. So it's been really interesting from that perspective. I haven't heard any informal feedback. But yeah, long story short, anybody ER/PR positive, HER2 negative in the sort of advanced metastatic setting. Yeah. And we find it really helpful. We just have a bunch of these printed pink sheets in clinic.
Oh,
and anyone too, like nurse or social worker. Our social worker here also suggests it, so you can spread it more widely.
Yeah, I found social workers are really working closely with the patients regarding their symptom management, supportive care. So we got a lot of referral from our social worker team at UHN as well. So I can also bring this poster print out to Sunnybrook if you don't mind receiving them. Would that be helpful, Dr. Pezo?
I think if you don't mind, maybe just sending around your presentation so people can get more information, because we can't distribute other things to patients unless they get reviewed first by our patient team.
For sure. This presentation will be distributed to you guys.
Yeah, great. So maybe I'll see if anyone else has any questions. Just feel free to speak up or any comments. I don't see anything yet in the chat.
The last thing that maybe I can conclude the presentation. So we try to promote active patient participation in care. So the main outcome of this study is patient activation. And it's a concept that to measure their readiness to participate in their own healthcare. And then the other ones are symptom management and access to care. Those are secondary outcome. But the main outcome is to increase their knowledge and confidence in participating in their own healthcare. So that's all for now.
I guess one question I had in terms of the resources and what it's directing patients to in terms of websites, are they like mainly Canadian sites or is it a mixture?
It is a mixture, but mainly 90% are Canadian sites. Some we included some Americans ones, and even Australians, I think, but very, very minimal. When we don't find any resource locally from Canadian content, we reach out to the United States and Australia and UK. So, but they might be composed of less than 5% of the entire recommendations.
And just to clarify, it starts by directing them to the Princess Margaret or UHN information. Is that right?
Yeah, we used let's see, like if it's services. Yeah, mostly UHN resource, but
because I guess.
But this is for navigation. Other than that, the information that they're like for symptom management or psychological help, those are Canadian resource.
Okay. No, I'm just wondering because if our patients would be part of this, potentially they would be referred to the other hospital website.
Yeah, we could actually definitely add more information here. But then the when we build it, we only included in UHN information. But there are site specific, like how to navigate the site, right? So at this point, we didn't include Sunnybrook yet, but in the future we can.
How difficult is it just to add in, like in one or two places, the Sunnybrook resources, or even to, if you're thinking of expanding this more, you are probably going to need more hospital. Like which hospital are you at?
Which
open that.
We will also need your help as well. So someone from Sunnybrook has to verify the information with us.
Right. Yeah, because we have a lot of our own resources that we're that we've developed and we're developing for patients as well.
But good question. Like only the navigation part may not be specific to Sunnybrook. The rest of it, it's pretty much universal.
Okay. Does anyone have any questions that's online? Okay.
Feel free to email at any time, and I guess Yvonne can send you the material and take some time to review it and see. I think if it's minor changes, Yvonne, you guys usually do it, right? Which is the nice thing about this fluidity of the AI resource. I think over time too, we'll have to work and update. Like there's even new treatments probably since we first reviewed things. Thinking HER2 is probably not on here for HER2 low. So we can reconnect about that too. But I think you're really just testing like the patient navigation portion as well. And like you said, their uptake. So those things can be added in time.
Yeah, true. But we just want to see if this is something that the patient actually want and find it helpful. Then we can expand and enhance further. Now it's like just a prototype.
Okay. All right. Thanks. I think Michelle has to run to her clinic. So good. Yeah, I think Yvonne, that was great. If you can send me the presentation and the information, then we can talk about it with the breast group.
Yep.
And get back to you.
Thank you very much for having us here.
All
And
right, thank you.
appreciate your time.
Thanks. Take care. Bye,
Take
everyone.
care. Bye. Thank you.